Hello and welcome to the Med Diary. Today we will be learning about anatomical terminologies. If you are new to my channel, please do subscribe it and don't forget to press the bell icon. Now let's move towards our today's topic. First of all, to understand the anatomical terminologies, you have to understand what is anatomical position of human body. The pic here shows the anatomical position of a human body in which we are standing upright. Head and eyes are directly straight ahead, upper limbs are slide apart, and upper limbs palms facing forward. Thumbs are pointing away from the body and lower limbs parallel, feet flat on the ground and facing forward. For the better understanding of anatomical terminologies, you have to understand what is medial line, or it is also called midline. It is a line that divides the bodies into two equal parts, for example, right and left equal parts. Many of the terminologies are used with the reference of this medial line. So guys, let's simplify all these anatomical or directional terms in the next slides. Firstly, we have the term medial and lateral. Medians mean toward the medial line or midline, and lateral mean away from the medial line. Let's consider this example in which our nose is medial to the eyes and our eyes are lateral to the nose. Students, you have to understand one important thing here, that we use this term with some reference point. For example, we call the eyes lateral with reference to the nose. If we talk about with reference to the ears, our eyes will be medial to our ears. So understand it. Next, we have the term superior and inferior. Superior mean above or towards the head, and inferior mean away from the head. The term caudal and cranial can be used alternatively for these. Cranial means toward the head and caudal mean toward the tail area. Now let's take a look on the example. Our heart is superior to the liver or with reference to the liver, or our liver is inferior to the heart or with reference to the heart. Next, we have the term anterior and posterior. Anterior mean toward the front and posterior mean towards the back. The terms that are used alternatively for anterior and posterior are the terms ventral and dorsal. Ventral mean towards the front and dorsal mean which is present at the back side. Let's take a look on the example. Our knee is present anterior and our elbow is present posterior. One important thing that can confuse is that our palm side is our ventral side and the back side of our hand is our dorsal side. Here you can see ventral and dorsal sides are shown with different colors. So next we have the term proximal and distal. Proximal mean near to the origin and distal mean away from the origin. Again, we will describe this term with reference to some specific point. For example, our wrist is proximal to the hand and elbow is proximal to the wrist. And the shoulder lies more proximal with reference to both the wrist and elbow. And same in the case of distal, our wrist lies distal both to the reference of shoulder and elbow. In case of the elbow lies distal through the shoulder but proximal to the wrist. Next, we have the term superficial and deep. Superficial mean that is near the surface and deep mean away from the surface. Now let's take a look on the example. Our skin is superficial to the ribs and ribs are superficial to the lungs, but our lungs are deep to the ribs and ribs are deep to the skin. Here we have unilateral and bilateral. Unilateral mean present on the same side and or one side, or bilateral mean present on the both side. Next are the terms ipsilateral and contralateral. Ipsilateral mean present on the same side and contralateral mean present on the opposite side.